Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we take a look at allergic rhinoconjuntivitis and how it affects children.
Most parents would say that they notice it first thing in the morning when they wake up. These children would often struggle through the morning with that. The first few periods of school they would be doing that, and then by lunchtime they seem to settle down a bit. They may sneeze a lot, they snort a lot, their throat tickles them, so you hear them doing this noise like because it's irritating them at the back of their throat. And generally speaking, it's quite disturbing as well as annoying for people around them.
Allergic rhinoconjuntivitis is a common disorder that's often undertreated and taken for granted, and according to Dr. Renita Jagru of the Well Kids Clinic, it's on the increase.
What I like to say is that there are allergies which involve the upper respiratory tract, for example, allergic rhinitis, which is where people have runny itchy eyes, runny itchy nose and sneezing. Sometimes others who have actual wheezing, which is otherwise referred to as asthma. In older kids or in younger kids, we refer to it as reactive airways disease.
The pediatrician says if a couple has a strong history of allergies, chances are the children will have allergies. Apart from family history, she explains that the environment is sometimes a major trigger: pollen, the Sahara dust, and particularly the house dust mite.
One of the big causes, apart from just pollen and environmental things, is something known as the house dust mite. And this is a mite which exists in most people's houses, in their beds, in their carpets, amongst the stuffed toys. It exists. We know it's related to the actual dust, which tends to be amongst these kind of things, and it lives in the fluffy things like our sheets and stuff like that.
She recommends that parents and caregivers should try to maintain clean, airy rooms for allergies.
I would often advise parents to remove the carpet, get rid of as many of the stuffed toys as possible, and just try and keep one stuffed toy that's continually washed and put in the sun as often as you can. Change their sheets regularly. Make sure the mattress covering that they have isn't one of the very fluffy ones, but it's just a plain mattress covering. Blankets are not a good idea. It's better for them to use things like sheets as opposed to quilts. So those are some of the things that you can use to help reduce the amount of the house dust mite.
Though allergic rhinoconjuntivitis is chronic and irritating, parents can prevent flare-ups or relieve symptoms by using appropriate medication.
There's nothing wrong in giving the antihistamines every day or for a couple of weeks and watch and see how they go. And then when you realize when you don't give the antihistamine, the child is quite struggling with it. The reason why we prefer not to be giving antihistamines on a regular basis is, one, they do make them sleepy. And if you have a child in school and you're giving them Histil every day, they're going to be falling asleep, for a major part of the day. If they're not sleeping, they will be sleepy. And so how much information they're actually taking in during their class time is debatable. So that is why first of all, there are non-sedating antihistamines which are better. There are also drugs that you can give and sprays for the nose that you can give that reduce or prevent the allergic rhinoconjunctivitis. And there's also eye drops that you can give for the allergic conjunctivitis as well. So we tend to try and encourage parents to go down the route of prevention of the allergic rhinoconjunctivitis rather than treating it when they actually have it.
If left untreated, the doctor warns it can lead to other problems.
One of the things that can happen with kids, especially if they develop these symptoms early, is that their adenoids can become enlarged, because their adenoids are tissues, lymphoid tissues that exist that basically react in the presence of all of these allergies and become enlarged. Even their tonsils can become enlarged, and then they can have problems with snoring, mouth breathing, and often they have to then have those things removed.
Dr. Jagru advises that parents can use over-the-counter medicines such as Histil to treat the symptoms, particularly in mild cases. but she cautions that if a child is having regular flare-ups, you should seek medical attention.
If it's something that's on a very regular basis, every day they're struggling with the runny itchy eyes, runny itchy nose, the snorting, the coughing, whatever, and you think it's even affecting their morning sleep as well as their ability to function at school, you should really seek some medical help.
You can also try our health tips.
Reduce your exposure to allergens. If the air is dry and you're having sinus problems, keep your nasal passage moist with a vaporizer. Use supplements to help with allergy symptoms.